Sickle cell anemia is a life-threatening hereditary disease. It's a condition most commonly seen in African Americans.
Sickle cell disease is a genetic disorder in which the red blood cells are produced in an abnormal shape. And because of its abnormal shape, it can cause problems in the body.
This disease stems from abnormal red blood cells. Sickle cell is caused by hemoglobin S, which is the protein that lives inside the red blood cell and transports oxygen throughout the body. Sickle cell is usually diagnosed at birth, but the effects from sickle cell usually don't start until you're around 4 months. About 1 out of every 600 the effects started early. Have sickle cell anemia, and about 1 out of every 10 share the gene, meaning they have the sickle cell trait.
The trait is only like half having it. You don't have the pain and go through all the other stuff as having the disease.
They're born with sickle cell. There are two genes, one that comes from the mother and one that comes from the father. If the mother and the father both have a sickle cell gene and the child gets both of them from the parent, then the child has sickle cell anemia or sickle cell disease. If you only get a sickle cell gene from one parent and the other parent's gene is normal, then you have a sickle cell trait. And with sickle cell trait, you don't have all the medical symptoms that you have when you have the disease.
I have sickle cell anemia. My mother had the disease and my little sister has the trait.
Most people living with sickle cell would consider life as being an obstacle because changes are always occurring throughout a patient's body on a daily basis. Taking medicine for sickle cell is mandatory in order to stay healthy.
Oh, it's very, very important. One of the medicines that sickle cell patients take is an antibiotic, and the reason they have to take it every day is because they're always at risk for a certain type of bacterial infection, which could be actually fatal unless they're on these antibiotics.
Like without my medicine, like the sickle cell can take me at any minute, even though I don't like taking it like that. But I know that's what keeping me alive is my medicine. So I believe it has something to do with that.
Studies show that hydroxyurea reduces pain in your chest and stomach and also helps difficulties with breathing. Although the medicines are helpful with relieving the pain and staying healthy, the reality of the fact is that expectancy for patients with sickle cell is not long at all. It's increased in the last 18 years, but it's still on average to be about 55 years of age.
You know, the life expectancy is supposed to be like to 55, but a lot of times people don't live that long. Like with sickle cell, just everything can go wrong in your body, and I think that's what happened with my mom, and it eventually took her life. She had sickle cell disease also, and she had me at the age of 17, but around the age of 5 when I started getting pain is when I guess hers got worse, and at the age of 22, she passed away due to complications with sickle cell.
Healthy eating diets are very important to keep up with while having sickle cell anemia.
Not any special diet. They should eat well because they're always anemic, so they should eat well enough to try to prevent severe anemia.
Many greasy and fattening foods are types of foods that are triggering a pain crisis.
Yes, I had to get my gallbladder removed once. It was Valentine's Day, actually. I got sick. I was eating Chinese food and then started feeling sick. So I went home and laid down. And at first it was feeling like cramps, real bad cramps. But then that's when I started feeling like more sickle pain. So I told my grandma, and we tried to take it down with pain like we usually, with pain medicine. But that didn't work, so I had to go to the emergency thinking it'd be one of the regular visits. I get some antibiotics and come home. But I had to get like CAT scans and MRIs and everything. They said like I was passing gallstones. That's why I was in so much pain. So I had to stay in the hospital a few days and get my gallbladder removed. I was like scared when they told me that because like I'm thinking surgery, like shouldn't be getting surgery at a young age. But I knew because of my disease like my body's kind of different.
Balancing calories
So I was
intake is
scared, but then
important.
it's like,
More calories
it
are
was
needed to
better
get
for
rid
my
of the
body.
damaged cells. Taking medicine is mandatory in order to both stay healthy and alive while living with sickle cell. The antibiotic that is prescribed is penicillin, and it is usually around 2 months of age. This medicine is used for preventing infections which can be life-threatening to small children. Hydroxyurea works as a pain reliever for sickle cell patients and decreases the need for more blood transfusions, but it also can increase your chances of getting an infection.
I take penicillin, folic acid, and hydroxyurea.
Well, they take an antibiotic every day to prevent infection. They take certain vitamins to help build up the blood. They have to always keep themselves well hydrated to try to prevent sickle cell crisis. And then when they do have a crisis, then they're managed with hydration and with pain medication.
Some pain medications that are usually used by sickle cell patients are morphine and ibuprofen. Exercise is also very important with staying healthy with the disease. It helps you prevent fatigue and keeps you energized. However, over exceeding your limit can result in pain episode, which is not a good feeling.
Sometimes it's sharp pain, or sometimes it's just like a dull but painful pain.
Sickle cell anemia causes a lot of physical problems within your body. Hand-foot syndrome, anemia, infection, acute chest syndrome, and stroke, and much more. In the United States, 1 out of every 10 African Americans is born with sickle cell trait. If you have the abnormal protein, hemoglobin S, then chances are your offspring will have either the trait or the disease. If one parent has sickle cell anemia and another has the trait, they're most likely of the offspring will be born with sickle cell anemia is 50%. While research with sickle cell is still developing, the disease has came a long way. In the past couple years, new medicines have been discovered and the life expectancy is still has nearly doubled from the early 30s to the late 50s. There is a cure for the disease now, a risky bone marrow transplant.
It's a cure for the disease, a bone marrow transplant, but they said like you have a lot of complications afterward. Like sometimes it don't even always help. You go to the hospital a lot more. Like you don't have sickle cell no more, but you're still going through a lot more stuff with the crisis.
And while all that may seem
like,
bad,
yeah,
the
it
process
could
of living with this disease is still very hard, yet learning one. Being 18 with sickle cell anemia gets very hard and stressful at times. Sometimes you feel all alone, but the best thing to do is surround yourself with positive people.
My friends, they treat me regular, so it's like I'm like a regular teen, just except for the disease and the crisis. But I do everything regular, go home, do homework, go hang out with friends, and yeah, get in trouble like a regular teen.
Okay. Just like regular people, patients with sickle cell has goals too.
Yeah, I did want to be a hematologist, but then I wanted to work with children. But I think it'd be good, like for me, to learn more about the disease itself. Even though, like I know a lot, but I don't know everything, and I want to know that and then educate others on it. Because a lot of people don't even know what sickle cell is.